The theme of this conference is early detection and early treatment, and I think that is something that we had to reflect about during this conference. This was my second slide. Can I get the first one? As you might be aware of, I've been in the field for more than 30 years now, and during this time, the incidence and prevalence of neuroendocrine tumors have constantly increased. And of course, it's an increased awareness among physicians in different countries, but it's also, I think, better diagnosis and better treatment that at least the prevalence will increase over the years. But as you see from this slide, almost all types of neuroendocrine tumors have increased significantly. And that is something that will continue, I can tell you from the last figures from 2007. That is something we had to take into consideration during this meeting. The other thing is that what is standard of care? And I can show this slide because we are in Canada, not in US. And the yellow line, that is what the patient can expect when they are coming to a center of excellence for neuroendocrine tumors. It's our own center in Uppsala, and this is survival for metastatic mid-gut carcinoids. The three other lines are taken from the SEER database. You know, the SEER database containing data from 40 different states in the US. And as you can see, there was an improvement after the introduction of somatostatin analogs from 17 months median survival to 37 months. But the last compilation made by James Yao in DCO this summer, it's still 33 months. So over the last year, it has not been any significant improvement in survival for patients with metastatic mid-gut carcinoids. I think this figure should be compared to a center of excellence where you can reach 115 months median survival for this group of patients. And I'm quite convinced, and I know also from knowing people in US working in center of excellence, that they have similar survival data. So therefore, I think it's time to consider that these patients should not be treated by every physician. They should be concentrated to centers. By that, I think I will let the first speaker come up, and that is Professor Richard Warner, and he is Professor of Medicine, Mount Sinai School of Medicine in